I recommend don't get a rooster.
Oh, no, I have a great rooster.
Oh, really?
His name is Randy.
Randy the rooster?
Yeah.
How do your neighbors feel about the rooster?
Honestly, well, he's a fancy rooster,
Okay.
so his crow is not very loud. But we also live in the middle of nowhere. So.
Got it.
So if you're a fancy rooster, you don't crow as loud?
Okay. Well, Randy doesn't.
Okay. I've never heard that.
Yeah.
Hello, everyone, and welcome to the latest episode of Sounds of Health. I'm your host, Dave McNiven, and I'm excited to welcome our guests today, Dr. Carolyn Gross and Dr. Bennifer Lansdowne, the founders and co-owners of CareFur Veterinarians. If your interest brought you here to listen to CareFur, please be sure to like and subscribe to Sounds of Health, where every week we uncover inspiring stories, meet incredible people like these two, and share valuable resources to help you boost your physical, emotional, and financial well-being. Carolyn and Bennifer, welcome to the show.
Thank you.
Thanks for having us.
Of course, I'm so happy that you're here. You are the first veterinarians that we've had on the show, so that's a big thing for us
Nice.
as animal lovers.
Happy to be here.
First thing I want to ask, how do you pronounce veterinarians?
You're doing an okay job.
Is it okay?
Yeah.
Because I know there's veterinarian, there's veterinarian.
I think it depends on where you were raised.
Yeah.
Yeah.
Okay.
Yeah.
We typically just say vets.
Vets, veterinarian.
Nice.
Veterinarian.
Now, before we jump into kind of our podcast format, tell me a little bit about how you came up with the name, because I know the story is on your website and I think it's really cute.
Well, it was around the time when Bennifer was trying to get back together. And we have Carolyn, who is the care, and I'm Bennifer, and it was just a natural. CareFur came together.
Excellent. That's awesome. So usually we start by just asking you what your backgrounds are and what brought you to what you're doing today. So who wants to start? Give us a little bit about where you came from, what you did. Was this something you always thought you were going to do?
So, yeah, I was one of those annoying little girls who always said, I'm going to grow up to be a veterinarian. I love animals. I moved every 2 years in my life. So I was raised, my father was a captain in the Air Force. So
Oh, wow.
we moved a lot. We lived on military bases. We lived in different states. I never got to keep the same friends. So it was always animals with me. And so I always wanted to be a veterinarian. And you go through it. And at least in my experience, I had a lot of people tell me that it was hard and that I couldn't do it, and that, like I would be best looking at other professions because of how competitive it is. And
Really?
I had a learning disability and all that other stuff, but I'm stubborn.
Well, that's a good thing.
Here we are.
It served you well.
Yeah. And so then, going through vet school. So I went to college at UMass Amherst, and then I did my vet school training at Tufts. I was lucky enough to get in. It was my number one choice. And then I did an internship, which we can talk about for sure, for a year, just rotating at VCA in Shelton. And then I did a 3-year residency in internal medicine at UPenn.
Oh, wow.
And then I ended up in Connecticut.
That's fantastic. So Shelton was your first time in Connecticut?
Yes.
Okay. And then you liked it so much you came back?
Yeah. It was the first time in my life that I got to choose where I lived.
That's awesome.
Yeah. And
I love it.
I chose this state. I really love it. I have no intentions of ever leaving.
That's great. Good to hear. Well, I love it too. I'm born and raised here. How are we doing on that microphone? Are we okay?
Get a little closer.
Yeah?
Yeah, get a little closer to that one. Yeah.
Okay.
We don't want to miss out on anything you're saying.
Yeah.
Okay. Bennifer, how about you?
Very different story, which I think is cool amongst veterinarians. A lot of them are the annoying little girls who want to be vets, who I don't think they're annoying at all. My story is very different. I'm from Canada originally, and my first love was wild animals, and I wanted to grow up to be Jane Goodall or Diane Fossey. So I originally went to the University of Guelph for a wildlife biology degree. And even in the early 90s, I just found it depressing because we were losing land and animals already back then. And I discovered I'm a doer. Like I need to be able to do something that I feel like is helping. And at that university was the Ontario Veterinary College. So eventually I got into veterinary school. And it was actually once I was in veterinary school, I realized there are specialties. You could be an internal medicine doctor like Dr. Gross, an ophthalmologist, a cardiologist. And in my case, surgery was what attracted me. But I also knew I wasn't the top of my class, and if I wanted to specialize, I needed to do something else. So I added in doing a master's concurrently with my DVM, and that was in large animal surgery and clinical studies. And I originally thought I wanted to be a large animal surgeon, and there was one female surgeon there, and in my last year, she pulled me aside and said, "You don't want to be a large animal surgeon. If I had to choose, I would go into small animal."
Really?
And that was the first time I'd heard it, and it meant a lot coming from her.
Did she give you a reason why?
The lifestyle is pretty terrible.
Really?
You're up on call, doing colics in the middle of the night. The horse industry is tough. I was not a horse girl. I still don't know what a fetlock is.
I do.
What is it? I don't either.
It's a part of a horse.
It's a part of a horse.
Okay.
Yeah. So eventually I finished my schooling and I got an internship at Colorado State University, which was pretty competitive, but I know I got it because I had that research background and I had a couple published papers with my master's.
Right. Okay.
So that was the rotating internship. From there, I tried to get a residency, which is very competitive. I did not match the first year. So one of the surgeons there, Steve Withrow, who's a god of oncological surgery in our world, called Michigan State and said, find a position for her, take her. So I did an orthopedic fellowship for 1 year and then stayed on for a 3-year residency, rotating in orthopedic and soft tissue. And then after that, my husband was living in Switzerland by this time. I had met him in vet school, and we had lived apart for 5 years. And we decided we should probably see if we were still compatible. So I moved to Switzerland, and I was a research surgeon out at a orthopedic research institute for humans for a couple of years.
Oh, wow.
And then, I just want to fix dogs and cats, truly. And so we made our way back to North America, and we ended up first in Pennsylvania, and then through his work ended up in Connecticut.
That's amazing.
And we've been here for over a decade now.
And what does he do?
He was a large animal surgeon. He now works for industry. So he works for Medtronic, which is a medical device company in North Haven, Connecticut.
And how did the two of you meet? Like you two?
Us two, yes. Our love story is better. We met working in a specialty practice in Connecticut. We don't work there now, but that's where we originally met. And it was, I would say, love at first sight, just in terms of how we work together.
Oh yeah, I think it is a little bit of a joke in medicine in general that surgeons and internal medicine folks sometimes clash, but we understand each other.
That's great. So you had some crossover together. You actually were working on patients together?
Yes.
Yeah.
That's the key. It's the patient-centered. Like when you look at a patient and all you want is to help it.
Yeah.
I love that Dr. Gross has a different perspective, like totally different than mine. And so that we each bring our skills and our just knowledge to a patient for that patient. And we've never stopped. Patient-centered is the sweet sauce.
Yeah, I think it's the trust. So I trust her opinion on anything when it comes to surgery. Like I've never worked with someone who I have so much complete faith in, and I think the reason why I trust her so much is that she expresses her own self-doubt when it's appropriate, when she is truly not feeling like something is right or that there's an issue. Like she's gonna let me know and not try to hide it.
Yeah, that's important.
Yeah. So it's that sense that I know we're going to communicate with each other.
Yeah.
That's all important.
That's great. Yeah. One thing that you had said, Jennifer, was about the specialties. I don't ever really think about the fact that there are specialties within animal care.
Yep.
And so when all of us, I have 2 dogs myself, and when we bring the dogs to the vet, are most veterinarian places like general practitioners? And when is it that you actually do go see a specialist with your animal?
Yeah, your vet is like your primary care doctor.
Okay.
And a good primary care veterinarian, such as CareFur Veterinarians in Madison, Connecticut, can do all the basic. It's the wellness stuff and the first line of blood work and x-rays and surgery and dentistry. That's all elective and basic. And then when you start to get into, there might be something wrong here, or you're showing signs, then you may or may not be referred to a specialist to work it up. And it's very similar to human medicine, like internal medicine. So that's Dr. Gross. She does endoscopy and ultrasounds and more advanced, blood tests and a lot of medical management of things. You have ophthalmologists for your eyes, cataracts, lots of surgery happening there. We have medical oncologists. We have the surgeons, both orthopedic and soft tissue. You have cardiologists. You have criticalists. So if you're seeing us, your dog is sick or has had a severe trauma or has a large tumor and you're not willing to give up. But we work hand in hand with the primary care veterinarians. That relationship is very important for us because, they're the ones that have the long-term relationships with most pet owners. But that's also why we wanted to start CareFur Veterinarians, is because we wanted a really good primary care veterinary clinic.
And so are all the specialists in their own practice typically?
So most specialty hospitals are owned by someone else, and the specialists practice for them. Because it's really very expensive equipment that we work with.
I'm sure.
Yeah, and we require multiple staff members for each specialist, and really having a centralized location where multiple specialists can work together is key. We're not an island as specialists, so specialty veterinarians typically don't own their own practice, but general practitioners can and do own their own practices.
Okay, and so the specialists would typically go from one place to another?
No, most of us are stationary. Some of us travel.
Okay.
But,
So it's usually a large referral emergency and specialty practice.
Gotcha.
That's when your primary care isn't open. You go there and then you might get transferred to a specialist.
I can chime in a little bit about that because I had a dog that was specialty needs, and my dog had a heart murmur. So we constantly, regularly would take her to a cardiologist, a specialty cardiologist for her. And in that relationship of early detection and also treatment from my primary care physician really helped. And she lived a long life because of that, and it all comes with just like people, early detection of some things and then referral out to a specialist, often helps in the longevity of a patient, So I just wanted to chime in there.
Yeah, thanks for that.
Exactly. And so, for instance, if your primary veterinarian does wellness blood work and they find elevated liver enzymes, and there's multiple causes of elevated liver enzymes, so they may recommend coming to see someone like me to do an ultrasound of the liver and further workup of that organ. And if I find, say, a liver tumor, or that there's something going on with the gallbladder where it needs to be removed, then I would self-refer to Dr. Lansdowne for that type of surgery, and they can get that done in the same facility and hopefully have a good outcome.
But then I would send it back to Dr. Gross for the management or the primary care vet.
Yes.
Gotcha. Okay. So that's really interesting. I've never really thought through the business of it all and how many people are really involved in the health of our pets and the support that you can have for your pets. I have two things I want to mention. One is when you guys arrived today, one of our colleagues had asked, what do veterinarians have to do with health? So I wanted to clarify that because even our audience might be thinking, does this really fit the Sounds of Health kind of format? And yes, it does. And here's the reason why. One thing that we do with this podcast is we cast a really wide net, and we try to touch on a number of different topics, and we try to highlight the various resources that people have in their communities. I find that pet ownership and companionship is so important to a person's overall health. I know that we all in my family have benefited from having pets in the family, and I think it helps with everything: physical, emotional health. Probably not financial. It's probably not good for your financial health in some ways unless you plan for it. But that's really the reason why, we wanted to have you guys on today, because also it is such a huge responsibility to take on pet ownership, and knowing what to do, especially in a time of crisis, is so important. So helping to alleviate a person's stress about those things, I think, is a really good thing to do as well.
Yeah, I have 2 points on that.
Yeah.
Number one, financial health. It is astronomically expensive to see a specialist. We are at the pointy end of it all. I don't know how people afford it, but pet insurance is a thing now, and it is still a good thing. It isn't quite as complicated as human health insurance.
Yeah.
If you're getting a puppy, you need to be getting pet insurance. And there are tons of companies out there. You can find one that, you can afford monthly. But if your dog gets hit by a car, eats a squeaky, you're easily at $7,000, and it's like, okay, leave the deposit today before we do the procedure, and it's not because we're money hungry. It's because that procedure would be $50,000 if you were a human, and it's the exact same procedure. So it is very expensive. There's no way around it, but for your own financial health is to have that insurance.
So you recommend if someone gets an animal that they go with pet insurance. Does that include older pets?
So it can. The premiums are higher for older pets, and they don't tend to cover pre-existing conditions. So there is that thought to it. So if you are proactive and get it when animals are younger and lock in a nice low rate for a healthy puppy with no other issues going on, like that's the time to do it.
Yeah, that's really important to understand. And if you have questions about it, it's really important to talk to somebody who's knowledgeable, especially with insurance. That's what we deal with every day with health insurance. So that's a really great point. You said there was...
You should get into the veterinary health
I know, we probably should. We should add that to our product portfolio. You said there was a second thing.
Yeah,
right?
Another thing is I see a lot of dogs for lameness evaluations, and many of them are not surgical. And I can usually tell that right away. And that leads me into this relatively long discussion about movement and arthritis and what you can do to live a healthy life. And mostly I'm talking about the dog, but I'm often talking to the owners as well.
Yeah.
Low impact, regular activity, keep the body moving, weight loss, a well-balanced meal. I mean, I think it is across the species that's what we need to be doing.
That's really an important point as well, because you hope when it's going well that pet ownership is keeping the human active.
Right.
Yeah. And I think bringing it back to what you said about how your pets are a big part of your mental health. And I think that's not just true for you. I think it's true for almost everyone who has a pet.
Right.
They've done multiple studies that have shown that, our companion animals help lower our blood pressure, that they're an important part of our emotional well-being, physical well-being. If you're out there walking your dog, if you have someone to come home to, if you have responsibility that keeps you moving even on your days off, like it is a huge deal.
Yeah, for sure. The second thing I wanted to ask about is you guys got into this field. Obviously, you had a desire, sounds like both of you from a very young age, to work with animals and to help them. But did you ever think you were going to own your own business? And what was that transition like for the two of you?
I would say no, just because I didn't think I was cool enough to own something.
Well, you have to be cool.
Well,
apparently.
there was no entrepreneurial spirit anywhere around me, but it was always just, we can do this better. Like we can do. It was just, to me, veterinary medicine actually is about the people. If you create a team of the right people, anything can happen. If you have people with skin in the game and who are just those workers, those are the people you want looking after your pets. And we surround ourselves with that in our day-to-day job, and we just wanted to extend it out and make it bigger. And that, I think we've done a beautiful job of that. Like the people that we have working at CareFur Veterinarians are the heart and the soul, and they're competent and they're compassionate. And it's a beautiful thing. And no, if you asked me 5 years ago, I'd say no way. And now I'm like, yes, of course. It's beautiful.
Yeah, I agree. And I think if we find ourselves in this position sometimes where we get frustrated at how other people run things, or, how the people that we work for run things. And I think there's always this thought, like we can, like Jennifer said, we can do it better.
Yeah. Well, the best businesses solve that problem, right? Like you notice something that's not as efficient as it should be, or not as good as it should be, and hopefully you solve that issue.
Right.
I can give a shout out to the people over at CareFur, because I have them as my primary care vet. I have Dr. Becky Murray as my primary care, and she's wonderful. Here's the thing about vets is that people will follow the vet regardless of where they're practicing, and building that team of community is essential. Also, the setup at CareFur is so unique. You have two entrances.
Yes.
Yeah. I find that fascinating. One for dogs, one for cats.
Yes.
So.
Yeah, because cats are very good at smelling dogs, and they're very responsive to that. Some cats don't live with dogs. Some cats have never seen a dog, and so having a separate entrance helps them not be as afraid when they're coming to the vet.
That's really thoughtful. It sounds like you put a little thought into the design of the place.
I feel like we thought about everything.
Yeah.
Like from, the flow. That's my doing it part of things. I just love, you walk in here, you're a client. This is what you do. This is what you want to see. Okay, you're a dog. This is what you do. This is what you want to see. It was really fun designing CareFur.
That's great.
I still have joy just walking in that building.
Yeah. And we thought about the vets for a long time too. Our all 4 veterinarians that work at CareFur are people that we would trust taking care of our own pets, which says a lot because we are
Absolutely.
particular human beings.
Okay. So do you treat lots of animals, or dogs and cats only, or what is that like?
So right now CareFur is dogs and cats only.
Okay.
We may end up having a veterinarian at some point who could treat exotics or pocket pets or things like that. But
Sure.
But the key is it has to be that person driven. Like they have to be passionate about it, and we'll be there to support them. But what you can't do is just advertise that you see specialty, exotic pets, and then just hope somebody is willing to do it. It doesn't
Right,
work
of
that
course.
way.
Yeah.
You want the competent person who's passionate about it. We'll
Yeah.
support them.
Right.
Yeah. Well, I mean, as a business owner, you're thinking on a few different levels, right?
Right.
So you have to find the right person who fits your culture and your fit. And
Yep.
yeah. And how big is your staff now?
We have 13.
That's amazing. And how long have you been in business for?
Not even 2 years.
Wow.
January 2024.
How many did you start with?
Too many. Our payroll was like
Started with 9.
almost 100% of our.
Yeah.
Still pretty high. But again, back to the people.
Yeah.
Notoriously, veterinary medicine, the reason the prices have been low is because the support staff is paid pittance. You'd have the one male veterinarian, and he would have his, bunch of girls that are paid below minimum wage. And we just refuse to do that.
Yeah,
Not only
right.
because we're women owned, but also because we see droves of veterinary technicians becoming nurses, not because they like people, but because they make more money. And it's the same job.
Right.
And so we were like, we got to fix this. So our staff has decent wages right now. And we probably started with too many, but we knew we would grow into it. And we have over 3,000 patients, unique
That's
patients
incredible.
already a year and a half in.
Wow.
And somehow AI found us, and the USA Today ranked us in the top 300 veterinary clinics in North America, or United States, sorry. It's my,
That's
my
fantastic.
Canadian coming out there.
That's really incredible. I mean, that is amazing success right off the bat.
Yeah, but now we have to worry that we're going to be too successful, right? So
Yeah.
we got to stay on
course.
top of that.
Yeah. Well, you can scale, right?
Yeah.
We want to stay quality, not quantity.
So tell me a little bit about what sets you apart. Where does the quality come in?
The people.
It's the people, finding the right people.
Yes. And having, I think I find from a lot of general practitioners, like there are so many good general practitioners out there. They sometimes don't feel comfortable reaching out to specialists. They don't, they sometimes feel like they have to do everything themselves or take care of everything themselves. And there's this anxiety with that. And it's hard. I think especially since you do develop such a trust relationship with your veterinarian.
Yeah.
And so I think that having Dr. Lansdowne and I as resources, like we cover so much of veterinary medicine for our vets and our staff that we're here as resources for them. We trust them. We're not telling them what to do. We're allowing them to do what they do best.
That's great.
And Dr. Murray was a big part of this. We've known her, since I've been in Connecticut. She's always been referred to us. And first she worked in Madison, and then she worked on Shoreline, and she's just always been alone, but had this loyal group of clients who just loved her. And we loved her as her specialty vets that she worked with. But she was always just seemed like she was floating out in the wind on her own. And we're always like, you know what? We're going to build you something beautiful so that if you want to be a vet for one day a week till you're 90, you can.
That's awesome.
She may do that.
She may do that. Yeah.
That's a great thing.
Yeah. And again, it's about the people. And I mean, with her came her tech and her assistant and her receptionist. And, that was clutch for us. And we chose Madison on purpose because we felt like it was underserved. As specialists, we have referring vets from around the area, and we did not want to step on their toes. We are happy that there are great practices in Clinton and Brantford and the surrounding area. We don't want to step on anyone's toes. We wanted to just kind of fill a void, we felt like, in Madison.
Yeah. We're here as resources for them.
Yeah, that makes a lot of sense. It seems, according to your website, that your services are also very comprehensive. Are you doing everything in-house?
So we can. We are still using, reference labs and diagnostic labs to send tests out. It depends on the needs of the patient and what the veterinarian wants to do.
Yep, but we can do your dentistries and basic surgeries, the spays and the neuters and the mass removals.
Sure.
We have a lot of room to grow in there too. We have a beautiful operating room, as you can imagine.
Surgeon.
And what about something like urgent care? Are you guys open 24 hours or?
No, it's just Monday through Friday, 8 a.m. to 6 p.m., but we absolutely see our clients for same day appointments. That to me is the key. And during COVID, especially at the ER and the specialty clinic, we saw a lot of people who just couldn't get in to see their vet.
Yeah.
I would be spaying for $5,000 when a GP could do it, or we'd see an itchy ear. People are annoyed that they have to go to the ER and spend a lot of money to be seen.
Right.
So that actually is one of the goals of CareFur is, yes, call us. If you are a client, we will get you in that day.
I'm always impressed the number of vets that I see, other than my primary care vet at CareFur, also moonlight as ER vets as well.
Yeah.
In ER facilities. I think that's always phenomenal.
Yeah. And Dr. Lansdowne and I practice at a 24-hour facility down the road, which is really good. Central Veterinary Hospital in Guilford.
Oh, that's
so
great.
We're right there, and we work there full time. We're there, and so CareFur communicates well with us as a hospital.
That's awesome. I'm sure that's really important to have.
Yes.
So what are your goals with the business? I know you're pretty new and it sounds like you've grown pretty quickly, but do you have in the back of your mind where you want to go with it?
Well, this is a little bit my retirement plan. I'm going to be the old lady doing spays and neuters in the back room, because what we do it's high stress level, major surgeries every day, saving lives. It's an emotional drain. And sometimes you just need to step back. But at the same time, I don't know that I'll ever not want to work. That's kind of just how I'm hardwired. Same. So it's always been about just competency. We don't necessarily want quantity. We want to be different from the corporate veterinarians clinics that are out there. And we can talk about that if you want to. Personalized, but yes, I hope to be involved with it personally. We're not out to make millions and millions of dollars. We do this 100% for our patients and the love of veterinarians and supporting all the staff in veterinary medicine.
Yeah, and I think to that point, I would like to add, I have been asked by a couple of colleagues actually since we opened, they kind of ask like, oh, when are you going to sell? Are you going to sell? Because it's valuable. And I think the answer is always the same, that is not our intention with this practice. We wanted to have something that wasn't going to become owned by a corporation or having a private equity firm involved in our finances. Like that's something that we feel very strongly about. We wanted to have something that we lived with and built and kept.
Yeah, that's really great. I mean, is that the trend in the industry? Is these practices will open and then sell?
Yes.
Yeah. I mean, I feel like it's every industry these days.
Yeah, they're getting a bit sneakier because it used to be that they would label it, okay, now you're a VCA or now you're a Pet Shield or whatever. But now there's a lot of private equity groups that go in and they just buy it and they don't change the name. So clients don't have a clue that it's no longer privately owned or owned by veterinarians.
And
that's interesting.
That gives you folks something unique that you can do. Like, for example, you had the Run for Remembrance, the 5K over at Hammonasset Beach. Like, no other vet really does that in the area. They don't sponsor types of events or anything like that when they're owned by a larger group or anything like that.
Yeah. Clinton Vet was also helping out with that one, you'll notice, but they are also privately owned.
Well, I love also that you find it important to pay the right wage to the people working for you, because how can a business be profitable if you're not paying your people the proper way? That doesn't make a whole lot of sense.
Yeah, we've had zero turnover. Nobody wants to leave. People want to die in CareFur.
Which is really good for this profession, having no turnover yet. So if our staff is listening, please stay.
Those are all the cartoons on the website. I saw all of them are cartoon people.
Yes, people are very happy when they get to choose the cartoon.
I bet. That's a lot of fun too.
Yeah.
That's awesome. Well, how do people find you if they want to reach out? And also, what is your service area like being in that one location? How far do people travel to come to you?
I mean, I think we have some clients who drive up to an hour to come see us. They're mostly chasing after the vets that left other places and are coming there. And so, I mean, we're open to new clients if they want to give us a call, and we're happy to schedule. And so our website is carefurvets.com, CareFur FURvets.com.
We're
Great.
also on Instagram and Facebook.
Awesome. And are Jason mentioned that you've sponsored a 5K, but do you have any events coming up? Are you involved in anything that's coming up?
I don't know that we're that sophisticated yet because we both have full-time jobs, but we do we donate to the Madison Library and the Lions Club. And I think there's a duck run in Clinton coming up for the diaper drive, because I bring joy in having the ability to help other, groups, especially local communities, major, importance to us. And the Run to Remember, which raises money for the Branford Animal Shelter, is a really fun event in Hammonasset. This is the second year, and it's just, come to remember the animals that you've lost, that you've had in your life for a period of time, and get in a good sweaty 5K. I hope it gets a lot bigger and we attract more people and bring your existing dogs to come too.
Yeah.
Dr. Lansdowne tends to run it. I tend to walk it. All are welcome.
What, did it pass already for this year? Yeah. When was it?
Yeah, it was in April.
Okay. Gotcha. Yeah, we'll have to keep an eye out for that event. That sounds like a lot of fun. Awesome. Well, I do encourage people to go to your website and to learn more about the awesome work that you guys are doing. Congratulations on all of the success.
Thank you.
Before I let you go, I'm going to ask you each for a health hack to share with our audience, something that you practice in your own lives that helps you to live healthier. And it could be something that impacts you physically, emotionally, or financially.
For me, I have to get in a workout in the morning. Have to get in a workout. I mean, obviously there's days where I don't, but if I don't do it in the morning, it's not going to happen. And it really helps my mental health. When you are sweating on a treadmill or I Zwift on my bike, you can't think about anything else. You need to be able to just clear your mind of any thought. And when you're gasping for breath, I found that's really when I can't think of anything else. And it's just like a mini vacation in the morning. And I just want to throw out one book that I found. I first listened to it as an Audible, and I've since bought the hard copy so I can highlight. But it's basically, The Wealth That Money Can't Buy by Robin Sharma. I just love the book. A lot of the things in there resonate with me. And a lot of what CareFur is that, we did not go into this for the money, as most veterinarians did not go into this profession for money. And I find a lot of wealth in what we're doing professionally and personally.
Awesome.
Yeah, I agree. I'm torn with my things, but my first...
You can give two if you want.
Okay, so my first thing is cooking dinner. I will sometimes, my husband and I will get home very late and we won't want to cook. Our inclination is going to be to do something fast and easy, but we always make ourselves cook together. And that has done wonders for mental health and physical health and eating good food that you're preparing. And then the second thing is I think it's easy, especially in this profession, to forget how much we love animals. So I always make it a point on my days off or anytime I'm home with my pets to just focus on them and spend time with them.
That's a great point too. I forgot to ask, do you both have pets of your own?
Yes, of course.
So what do you have?
Go ahead, Carolyn. She has the most.
Dogs, cats, chickens, bees.
Okay, give me numbers here. What are we talking about?
We're not going to talk numbers. It's
How
okay.
about number of dogs?
Just three dogs.
Okay.
Yeah.
Okay.
You can count the hundreds of bees.
Well, you can't.
Yes.
Yeah, you can't do the bees.
No, two hives. Two hives.
So do you collect the honey?
Yes.
That's awesome. I had a neighbor who did that for many years.
Yeah.
It's great.
I just have 2 dogs and a cat. They were all kind of animals that came in injured and needed surgery, and either they were found on the side of the road or the owner elected to euthanize. And that was a little bit back in the day where we could rescue animals and treat them and adopt them to someone else. We can't really do that anymore because of social media and the negative impacts of that. But they are all animals that would have been euthanized but now live happily in my house.
That's awesome. Jay, you want to tell us about your pets?
I have a dog named Penny. She is a patient of CareFur. We had a dog that we just put down in April that was also a patient of CareFur. But yeah, I love my dogs. They're wonderful. But I had chickens growing up.
Did you?
Yeah, I had
wow.
chickens. They're a very special pet. I mean, it's a lot of work, especially because you have to worry about critters.
Right.
And also the predatory critters. So yeah, but they're definitely rewarding. There's nothing better than fresh eggs, and when you get fresh eggs in the morning.
Yeah.
I recommend don't get a rooster.
Oh no, I have a great rooster.
Oh, really?
His name is Randy.
Randy the rooster?
Yeah.
How do your neighbors feel about the rooster?
Honestly, well, he's a fancy rooster, so
Okay.
his crow is not very loud. But we also live in the middle of nowhere. So.
Got it.
So if you're a fancy rooster, you don't crow as loud?
Okay. Well, Randy doesn't.
I've never heard that.
Yeah.
Okay.
Can't speak for other fancy roosters.
We also have 2 rescue dogs. We have a 10-year-old black lab, Buddy, and we have a 2-year-old beagle mix. He's an absolute terror. His name is Adley. So yeah,
Does he crow in the morning?
he does. He howls. Yes. He howls quite a bit, and it's hard to get him back inside. But yeah, it's we've gotten a lot of joy from our pets, and they are a very important part of our family.
It's wonderful.
Yeah. Well, I want to thank you both for being here today, and I hope our listeners got a lot out of this episode. I know we did. I'm glad that you're out there doing so much in the veterinarian world to really also improve the opportunities for people getting into the business. I think that's really awesome, and it's something we try to do in our field as well. So great job. Congratulations on the success, and hopefully we can have you back on the podcast at some time.
Thank you.
Thank you.
Absolutely. All right, well, that's another wrap on an episode of Sounds of Health, brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. As always, I'm your host, Dave McNiven. A big thanks to our producer, Jason Carubia, and for the amazing music by Rob Hames. Every week, we bring you stories that inspire, empower, and help you to upgrade your health and life. If you enjoy the show, please be sure to like, share, subscribe, leave us a review. We love hearing from our listeners, and we hope that you'll continue as an important part of our wellness community. Thank you. See you next time.